Good evening, everyone. So, shall we start? I'm just looking for the record. It should be here. Okay. Here. Can you hear me? Guys, can you hear me? Right, okay. سامعني رامي كده؟ All are Arabic speaker or anyone want me to go in English? All Arabic speaker. Very good. مساء الخير يا شباب. كله سامعني. لو أي حد مش سامعني أنتوا تقدروا تتكلموا على فكرة. أي حد فيكم يقدر يعني interrupt لو يحب. ف أكدوا لي بس إن كله سامع وكله تمام. Good evening, everyone. So today is our FRCS T&O Part B orientation session. My name is Mohammed Hashim. I'm a foot and ankle consultant at Wexham Park Hospital, Northwest London, Flemmy Health. We'll go through FRCS T&O Part B, step by step, how the journey, how to prepare, what shall you do, what shall you not do. Hoping all of you will be okay by the end of the session, so you will be confident. What should you do, and how can you achieve the success in Part B? Let's go. So the journey starts for Part B by passing Part A. So once you have the results with pass, you have to start preparing for Part B straight away. And if you are pretty sure that you will go for the next exam directly, so you need to prepare even before the result. And the journey for Part B carries four main parts: knowledge, courses, practice, and exam. And every part had the same importance like the other. So no one is more important than the other. The four limbs of the journey is very, very important. As any journey will start even always by an obscure view. You don't know where you're going, but what I can promise you is by end of this session, if you go with the advice, if you prepare well, there is still a sun behind the mountain, and the end of the road is very, very bright, and success is there, and very easy to achieve if you are well prepared. When you start to prepare for FRCS in general, especially Part B, you are all over the place. You don't know what to do, where to start, what courses to take, what books you have read from. Is it the knowledge? Is it the practice? Shall I like re-strengthen the points I was weak in part one? Shall I go for practice and ignore the knowledge? So it's a lot will be going inside your mind, and we are here today just to clear your mind and make you a clear plan. Remember that the plan I will give you is my advice and based on others' advice, from the courses I teach, from my colleagues and mates in the trust, from other colleagues, Egyptian colleagues all over here and there. But at the end of the day, you need to choose a plan which fits you. So you don't need to find the best shoes, but you need to find your shoes. So try to tailor the plan I will give you today on your needs, on your abilities, on your background, on your knowledge. The aim from this is just to guide you through the way, but you have to choose your way. And always failure to plan is a plan to failure. And this is very, very true. So, and especially with the FRCS. FRCS at the end of the day is a game. And if you know the game, if you prepare yourself well for the game, you will pass it very easily. If you not, you will never pass whatever you do. It's not a matter of knowledge, it's not a matter of studying, it's a matter of how to play the game properly. You're going to act, and you need to act as a consultant for them to be satisfied to pass you. Other than this, no. SHO registrar can have the knowledge, but they are looking for a consultant colleague sitting in front of them, speaking to them, answering their questions. So, starting with the journey, how can I prepare? You have to put a time frame, and the time frame for part B, if you are well prepared from part A with the knowledge, 2 to 3 months is very, very enough. So, but remember, I said if you are really prepared for part A with the knowledge. So if you have the basic knowledge, you need 2 to 3 months of preparation for part B to pass it very easily. If not, you need a lot. So if I passed part A by chance, I've done like minimal question answering and I went to part A, you will fail part B if you are not very, very, very clear with your mind that part B needs a lot of preparation if the basic knowledge is not there. You have to commit to a time, place, and table. So choose a place in your home. Choose a time to study every day. You must have it every day studying, and you must be having practice every day. Choose some buddies in your trust. Choose some consultants. Choose some online groups like the Ortho Bima we're doing, like the sessions I will be doing for you. But you have daily to study, daily to practice, and this needs to be a commitment. Use every second. So sessions studying needs a place, needs a time, but running with podcasts, running with YouTube channels doesn't need to be in a certain time. So between the cases, in the clinic, during break time, when you're having your lunch, just keep YouTube running, a lot of YouTube channels, a lot of YouTube videos showing you the exam, showing you the knowledge. So run through them and try to use every second in your preparation. Plan your leave from now and plan your rota. Try to take a very, very light placement or a light rotation. Give yourself a lot of time to study, a lot of time to prepare. Your first time is the best time to pass, so try to use it as much as you can. And if you feel that your rota or your leave is not fitting this time, so you can defer the exam to the next time. There is no rush between the exam and the next exam. For 5 months is not a big issue. But remember, the first time is the best time to pass. Plan your budget because the courses are very costly, and try to save your study budget from the trust for the courses because you will pay a lot added to this budget. So knowledge coming from part A, if you are well prepared in part A with Miller, so that's absolutely fine. There is some gaps between part A and part B. So in part B, there is a lot of concentration on anatomy, a lot of concentration on basic science, which they are not very well covered in part A. So if you have done part A properly, if you prepared yourself for Miller with all the subspecialties, including the anatomy and basic science, rest assured you're done with the knowledge and you need to practice. But if not, please, you are the best one to know your gaps. So please fill your gaps from part A. Yeah, it is not a knowledge exam. Part B is not a knowledge exam. But this is based on you have the basic knowledge. There is no point that it's not a knowledge exam means you don't need the knowledge. No, definitely you need the knowledge. If you don't need the knowledge, there is no point to practice. You cannot do something you don't know about. So you have to have the basic knowledge. Yeah, the exam is not about to test your knowledge, it's test your practice. But at the end of the day, based on you have the knowledge from part A. So if you know yourself don't have the whole knowledge from part A, please go back and fill your gaps, especially anatomy and basic science. Myself, I've used for anatomy, Miller and Concise orthopedics notes, and for anatomy from like 15 years ago, I'm using Knitted. So there is no excuse for the basic knowledge. There's no way that he asks you a basic question and you don't answer, you're done. He will not go anymore because we're speaking about practice and higher order thinking. This means you're already done with the basic. You stand on a very, very solid base. If you don't stand on a solid base, there is no point neither to act nor to give a high order thinking. Be concise and try to use concise orthopedic notes as your working horse. This book is a very nice book written by one of our colleagues for us, and it is in the form of the notes which we adapt to read from or study from in the old days in the undergraduate and in the master degree and this stuff. And it's very nice. It's nearly covering everything. You don't need more knowledge in this to pass. If you want to achieve scores and get eights, yeah, it's a lot to read more. But basics in concise is enough for you to get at least the pass mark. So concise can help you refine your knowledge from part A and make it suitable for part B because it is directly planned for part B. You can add on Viva practice from Balaskovic. You can add Ramachandran as basic science. You can look in YouTube channel. I have basic science course on YouTube on the Egyptian Orthopedic Association YouTube channel. You can use it. We'll cover a lot of your basic science in no time because you can use it while you're commuting to work or while you're in your car, while you're getting your lunch at home, when you have some time off. Regarding the knowledge for part B, which is different than part A, so we agreed that we have to have the basic knowledge from part A. But the knowledge specific to part B is the drawings. You have to know how to draw. And the best to do that is Quintang YouTube channel. So Quintang is a very, very good YouTube channel. Quintang was an old trainee from Royal London, and he is perfect in drawings, and he understands nicely everything behind the drawing. So you need to follow this. Go to Quintang YouTube channel, study it by heart, will help you in studying, help you in how to draw, and how to draw while you're understanding what you're drawing. And this will answer a lot of questions in the exam, will shorten a lot of answers in the exam, will give you more time to score more marks in the exam. You have to have a knowledge about the medical legal aspects. This I will send you in the group. It's a lot of specific medical legal questions which comes to part B. Because you understand and you remember we said they are dealing with a day one consultant. And day one consultant is not only a surgeon, is not only a clinician, but you have management rules, you have medical legal rules, and you need to know about. You need to know about the guidelines, especially the nice and post. There is no excuse again in nice and post. If your answer contains something which goes with the guidelines and you didn't mention the guidelines, it's a big mistake, and you will lose a lot. So you need to be aware by all guidelines, nice and post. You need to understand and know and read about the recent evidence, especially the novel papers and the trials, especially the trials that impacts on the clinical and affects the clinical practice and the clinical decision is very, very important. So the recent evidence is very important. If you understand the evidence, if you're on top of most of the evidence, that's absolutely fine. At least you need to know the novel papers, the trials, which impact the clinical decision, because this is a part of the basic knowledge. This is not an evidence. Then you have to have a specific practice points, and we will mention it later, and I will send it to you in the material I will send on the group. And you need to know the recent NGR report, and to understand from the NGR report what's meant by ADIB rating, and what we are using and why we are using an implant in different arthroplasties. You need to know what shoulder we are using, what is the best implant with least revision and problems, and this is a very common question. And because he will ask you in adult pathology, saying, "Oh, you will do a total hip replacement. What total hip will you use?" And you have to justify what total hip you will use based on the NGR. And again, the NGR, it's one of the resources I will send on the group, including how to answer the question of NGR ideally. So I'll give you the model answer. The courses is a lot, I've done these courses, and these courses are very, very, very good. I've get a lot from them, even in my own practice, not just the exam. So writing it in upper limb is well known. Is a working horse in upper limb and hand. The good thing in writing it, and they have a lot of clinical cases which you will not see any other where. So writing it is a very, very important course for upper limb and hand. All the hairbeats is the same. So all the hairbeats, they have cases, they have a very, very, very informative and illustrative pediatric course, especially if you haven't done a pediatric rotation. All the hair pediatric course is the one for you. Let's talk, doctor, basic science. If you need some basic science course, if you're okay with basic science, you don't need that. Stem more foot and ankle is not an FRCS course, but it is one of the best informative courses and instructive courses which is having for foot and ankle specialty. So any one of you which are planning for a foot and ankle future, you can attend the course both for FRCS and for your foot and ankle. And for those who has no idea about foot and ankle, haven't done a foot and ankle rotation, and they are going for the exam, it's worth you going to this course to know what is the main clinical points in foot and ankle, clinical decision, and different operation, different procedures. The most important as well is the Blitz course of the Rishi Do from Let's Talk Doctor is a very, very good course. It's a practice course showing you how to answer, how to understand. It's not the exam, but the point is he gives you what the examiner wants to hear from you and how to achieve 6, how to achieve 7, how to achieve 8, how to achieve 9. I'm sorry, 9. How to achieve 6, 7, 8. And what is the answers which give you 6, what answer will give you 7, what answer will give you 8. This is not the real situation because you have an examiner on the other side of the table. But at least it will give you an idea how to achieve this. There is a practice course in King's College, another one in Chelsea, and I'm teaching in this course. So they are good courses to attend because it's practice and all practice. And this is one of the things you need to feel the exam heat, to feel the exam environment, to go in the exam mode. So I recommend both of them. And we will be doing a course of practice in the OrthoBima for you online, just a free one. And the other ones is nearly free. So Chelsea is just £100, which nearly cover only the costs of lunch and stuff. So these practice courses are very, very good. Go for them. Try to practice and practice and practice. So if we come, this is the knowledge part of it. What is basic knowledge needed? What's specific to part B? Now the practice is the second limb of the journey as we agreed. And the Viva, for the Viva, you need to practice, 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 practice. Without practice, you will never pass it, even if you are the best, you have the best knowledge. Because you have the knowledge and you go to the exam and you find it's a totally different game. You don't have a chance to say the knowledge you know. And if you are not practicing well and you know how to come with the answer and how to overcome the examiner interruptions and questions, you will end by saying nothing, even if you have the whole knowledge. So practice is a vital part of it. You have to have a group of 1 or 2 study buddies and not more than 2. So 1 to 2 is very good. And I think 2 is very, very good because you have, versatility. Some of you will be in leave, one of you will be busy. So if you are 3, you definitely will be doing a daily practice because one of you will be available to do that. Try to find a group in your hospital, even if they are not going to the exam. Find some people who are interested in teaching. All what you need is to practice with them. They ask you, you answer, and you come to know where is your defects, where is your gaps. Try online groups like the OrthoBima group. Practice with yourself, with your wife. Ask your wife to ask you the question if she is a medical, if she is a medical person. She can ask you the question and see the answer, and she can reflect to you back what's wrong, what you are saying right, what she feel that you hesitate in, what you feel she feel that you say absolutely wrong, even if she doesn't know orthopedics. The other option is just video yourself. So ask your wife if she is not a medical person just to video you while you're answering, and you will be surprised how much mistakes you're doing. Not in the knowledge, but in the sitting, in the attitude, in the language, in the confidence, in your body language. You're doing a lot of rubbish things. You're moving your hands, you're looking up, you're looking down, you don't do an eye contact with the examiner, which is a big, big problem. You make a lot of actions with your hand. You have a lot of tics. This is all makes you less confident in front of the examiner, and you need to work a lot on this. This is the difficult part to correct. The knowledge is easy part to correct, but these 4 things attitude, language, confidence, and body language are a bit difficult to correct. So for the Viva, you have to involve yourself in an MDT. So don't be shy, don't disappear, don't sit in the corner. When every hospital has an trauma MDT in the morning, get yourself intentionally involved. Get yourself to be asked, get yourself to be involved in a discussion, put yourself under the heat, under the grill, ask the consultant in the MDT to grill you in front of others, and this is how you will know where is the defect, where is the problems you have. You have to attend at least one oncology MDT, see where is the oncology referral center in your area, attend at least one oncology MDT, attend at least one hand MDT, attend at least one spine MDT. And this will give you a very good idea how they deal with the patients. And when you will mostly have a complex case, 1 or 2 or 3 in the exam. And if you have attended an MDT before, oncology, hand or spine, you will have the chance to understand how they work. I'm just checking that everyone is hearing me. So if you haven't done a hand rotation, go and attend at least 2 to 4 hand clinics. See how they examine the patient, how they deal with the patient, how they explain the patient the problem, how they treat the patient, what is the hand therapy they use, what the splint they use. And same for the beads if you haven't done a beads rotation. And if you haven't done any hand before in your life, please go and attend the hand list. See how they deal with tendon injury, how they deal with CMC, how they deal with Dickervan, how they deal with replacements, how they deal with all this stuff. For the clinical, you need to attend. You need to make yourself a system in the clinic. So it's always missed and misunderstood. Underestimated. You always feel that, all the people concentrating on Viva, a lot of courses, a lot of practice, Viva. No. Clinical is the one which will pass you, and Viva is the one which will fail you. So if you will prepare in the clinical can cover you even for a lot of Viva misses and mistakes. Because one intermediate case equal one table in the Viva. So imagine one intermediate case equal the whole basic science, equal the whole trauma, equal the whole adult pathology, equal the whole hands and beads. So if you done properly in the clinical, your chance to pass is very, very, very high, because there is no a lot of misses, there is no a lot of gaps to drop your marks. But in the Viva, there is a lot of holes to drop your marks. It's very easy to score because it depends on a whole assessment, not point by point. So you need to have a history sheet. You need to prepare yourself for any case to have a history, proper history in 3 minutes. Don't allow the patient to take you away. Know how to stop the patient, know how to get the information from the patient, know how to pull the patient back on track. You have to prepare a clinical examination system for yourself for every joint. I will send you my notes for the history, my notes for the clinical examination, but you need to take them and tailor them to your own way. So you have to have your own system, and you have to start from today to practice in your clinic. So when the patient comes to the clinic, you imagine this patient is in the exam, 3 minutes history, 3 minutes examination, and be ready to discuss it in 5 minutes. So imagine yourself in the clinic. If you adapt to do this in the clinic every day with every patient, the exam for you will be just a nice trip. You have to have a practice group. Don't go more than 3. So for all of you to have a chance to practice. If more than 3, the time will be very, very tight. But 3, one is doing for every system, one is doing the patient rule, one is doing the examiner rule, one is doing the candidate rule, and rotate between you. And at least once a week, you have to do a full session of clinical. Don't underestimate the clinical. Don't miss the clinical. You have to make your own system, practicing in all your clinics, and it needs to be a habit. If it becomes a habit, you will go for the exam very confident, and you will take it very easy, and you find that the clinical is the way to success. Try to deal with difficult patients in the clinic, and if you are not, you will definitely have someone in your trust which is very, very good in dealing with difficult patients, and try and how to manage them. Go and learn from him or her how they do that, because you will face a difficult patient in the exam, and you need to know how to come out from this. If we come to the exam as the last part of our journey, you need to understand the format. So for who has not sat the exam before, who is going through the first time, the exam happened on a Sunday for the clinical, Monday, Tuesday for the Viva, and they divide the people into 2 groups. Clinical is always on a Sunday in a hospital outpatient clinics. You have two intermediate patients, which will be real patients. Some of you will start with short, some of you will start with intermediate. The one who will start with intermediate will go for one intermediate upper, one intermediate lower. Every one of them is 15 minutes. And the 15 minutes should be 5 minutes history, 5 minutes examination, 5 minutes discussion. But the problem here, there is no ring. So the ring will be at the start of the station, and you have another ring at the end of the station. So remember that you need to have this as a habit. Otherwise, you will spend the 15 minutes taking a history, and you're done with the station. So 15 minutes for history examination and discussion. Then the short is a very good station to score. So short is your way to score. It will be between upper and lower, and the spine will be in one of them or both. It's 15 minutes each. Every table will ask you 3 questions. So it will be either about a clinical test, so show you like a picture, show you a video, show you a way to do a clinical test, and start asking you about every aspect of the clinical test. So in this Lackman, why we keep the knee in 30 degrees, why we bot, why we do, what we are testing, how it will be positive, how it will be negative, when it will be false positive, when it will be false negative. So you need to know every test inside out. The same for the clinical signs. So, what is that? This is a Geiser sign. How do you know Geiser sign? What's happened? Where? Why not a ganglion? Why not a nodule? Why not like that? What is the pathology behind? How will you manage? This is how it goes. Or a clinical scenario. This patient came to your, show you a picture. This patient came to your clinical, has something like in subtle hidden. How will you tackle this? How to examine this? How to examine this? How to examine this? So you need to be on top of everything. The Viva one will be either Monday or Tuesday, so between 2 groups. It will be definitely mostly in a hotel hall, a big hall. So you go in the hall. The hall is like 4 queues of desk. Every one is according to the number of the candidates. So if every group, the group which will be doing the AM session or the PM session, imagine they are 40. They will divide you into 4 groups. Every group is 10. So you will go in a hall with 4 queues of tables. Every queue is 10 tables. And every one of you go to a number. So I'm going to table number 1, and you go into table number 2, table number 3, table number 4, and we have an other group on the other queue of table, and a third group and a fourth group. So you are in a hall of 40 table. Every table has 3 persons, 2 examiner and 1 candidate added to the assessors. So it is horrible, and you need to adapt yourself to this. You need to know how to be very, very, very keen to understand the question, to listen to it. Most of the time, it will be difficult to listen. Most of the time, too difficult to pass the knowledge, pass the answer to the examiner because of the noise around you. And you need to adapt yourself to do this. It's not like a quiet room you're sitting there. This is one of the stresses of the exam. The tables will be, or the queues will be, 1 for adult pathology, 1 for trauma, 1 for hand and beads, 1 for basic science. And every station of them is 30 minutes. The bell will ring in the start. Then every 5 minutes, so you will be examined by 2 persons, 1 on the right, 1 on the left. Every one of them will be examining you for 3 stations. So the table will be total 6 stations. And every station is 5 minutes. So the total table will be 30 minutes. The normal, the formal, it should be 1 examining you and the other 1 assessing. So I will start with the left side examiner. He will examine me. He will ask me 3 questions, which means 3 stations. Every station will take 5 minutes. Should be on the right side. The right side one assessing, but this is not actually what happens. So, and you ignore this. This doesn't. You don't care about this. What you care about, you understand that I'm going, and like if I go from the start in table number 1, you will be going in table number 1 here, table number 1 here, table number 1 here, table number 1 here, and between each one will be a 5 minutes. And some people have a good 1 hour between tables. This depends when will you go in. Yeah. So if you go formally, starting from number 1 to number 4, you will go number 1, come out 5 minutes, go to number 2, come out 5 minutes, have like 15 minutes break, then go number 3, 5 minutes, then come out 5 minutes, then go for 5 minutes, again 5 minutes. If not, it's some people like I've done the 2 hours in total. With just 5 minutes, 5 minutes, 5 minutes. So 15 minutes break in between the 2 hours. Some people are taking 2 stations, relaxing for half an hour, then go for 2 stations. So it's different from 1 to 1. At the end of the day, you will do 4 tables. Every table is 6 stations, so in total 24 stations. Every station is 5 minutes. So what should I do the day before? So the day before, you have to be completely off. This exam is very, very exhausting, and it needs every point, every cell of your brain. So there is no point to load your brain. Don't force the tire horse. The day before your exam, you have to relax. You have to ignore everything. Have a very good sleep, at least 8 hours. Don't revise anything. All what you need is to get your ID with you, get your bag, go to a nice hotel, preferably the hotel where the exam will happen. Relax, enjoy, and if it's not, choose a very nice hotel, have a very good night, watch TV, Netflix, enjoy PlayStation if you enjoy PlayStation, go for a dinner because you will definitely have one of your buddies with you in the exam, have a comedy film, and remember, it's not you, it's Allah will be doing it. On the exam day, you have to go early. It's nice to familiarize yourself with the place, to know where you will go and how you start. Remember that station will end by ring. So station is done. Once the bell is ring and you're done, don't think about the station, neither positive or negative, because this will not make any sense. The station which is done, and the mark is marked, and there is nothing to change. It will be affecting the next station. So don't take anything from the station where you're going out. Once you held the ring, you're done with that, with this station. Don't think about it anymore. Go for the next station. Clinical is your act day. You need to know that you are going to just acting like an actor. So you're going on the stage, you have your own system, and give as more information as you can, and keep while you examine history, taking history and examining as much differential diagnosis in your mind. Viva is a different game, is a boxing game. You just boxing him and he's boxing you. So you're pulling and pushing. So don't go and like, no. It never works this way. You have to hear the question, take a deep breath, go back, and then start to answer. And the other way around. So before you start the first question, give yourself at least 30 seconds. So he showed me an X-ray. I take 30 seconds. I know what the X-ray is. How will be my approach to this case? And I go to this approach very confident and in a boxing way. He will be interrupting you in the middle a lot. But if you are on top of your information, you will never stop. And he will feel that you are really confident and you have done this before. If you are safe, you will take 6 and you will pass. So 6 is the safety question. 6 means the patient at the end of the station hasn't died. If the patient died by the end of the station, regardless what you did, you will not pass the station. So pass the station means you are safe. So you end by the patient is still alive, even if not properly treated. Don't offer any rubbish. So when you speak, it's not about how much you say. It's about how quality of information you give. So you are a consultant sitting in a trauma MDT, taking a decision of the patient. Ask a very specific question. Speak about a very specific points. Quote very specific evidence. Don't say any rubbish, because you will give him a chance. You will open a door for him to attack you. Remember, it's a boxing game, and you will not get a box until you keep your face exposed. If you're covering your face, he will never box you. Once you give him a chance to box you, he will do it very properly, and he will take you in a way which wastes your time and end by failure of the station. So be confident in what you say. That's why this is the importance of the first 30 seconds. With the first 30 seconds, take a deep breath, go back, have a look on the screen, organize your mind. What I will say in this station: if this patient come to my trauma MDT, how will I deal with this patient, and deal like you are in a trauma MDT? If you do this, I promise you, you will pass very easily, because you will be just telling what you know confidently, in a proper way, in a good language, and he will consider this. If you start to say anything, just filling the spaces, saying any rubbish, you will open a lot of holes for him to come in and box you. Be confident with every piece of information. When he say to you, "Are you sure?" he is not trapping you, but this is one of two. Either you have you have done a mistake and he asks you to correct it, or he feels that you say the right answer but not in a confident way, and he need to be sure that you are confident. It's not like by luck you said that. So when he says to you, "Are you sure?" Take it seriously. It's one of two. Either you already said something shit and you need to correct it, or you have said something correct, but he feel you are not confident. That's why he's checking again to be sure you are confident of what you answered. Remember, he is assessing a day one consultant, so always get an NDT decision. As a day one consultant, you'll not be treating oncology, you'll not be treating complex spine, you will not be treating complex hip, you will not be treating complex foot and ankle. So remember, MDT is not just a word; it's an actual life. If I'm sitting in my MDT today and I got a complex hip cases, I will not give a decision. I will be asking for the MDT. So remember, you are being assessed as a day one consultant. So you need to have an MDT decision. So how do they assess you? Because this is a very valid point to understand how the game is played. They say it is fair, but I don't think so. My experience doesn't say that because it's not like that very organized exam. You may go for a very easy examiner who is very keen to help you, and another station you're going for a very difficult examiner who just stopping you, who just interrupting you, who just breaking your mindset and your mind line. So it's not fair. It's an equal exam. I don't think so as well, because language makes a difference, face makes a difference, type of the candidate makes a difference. It's a professional exam. I don't think so. Why? Because basically all of this is my opinion. It's nothing about the exam itself. So it's a professional. Who can say that? It's professional means all of us will be assessed in the same way and with the same measurement and with the same criteria. But this never happens. Someone are very lucky who go to a very nice examiner, smiley, who he help you, and you say anything, you say, "Oh, very good, very good. What else?" And another one which if whatever he says, the examiner says, "Oh, no. You sure?" Ah, okay. What else? What else? No. So it's not professional. The professional means it's a common way of assessing the candidates, which is not there. They say it is a day one consultant, but I promise you, more than half of the cases are not for a day one consultant. And the common sentence is, "Oh, I will refer to oncology entity. You are the oncology entity." My exam, he asked it was a hyponatremia case and coming for pre-assessment for a total knee replacement. Then I said, "I will refer to hematologist." He said to me, "You are the hematologist." Man, you examining me as a day one consultant, orthopedic consultant. I shouldn't know how hematology treat hyponatremia and treat anemia. They say that they are keen to pass you. Not all of them, to be honest. Some of them, yes, not all of them, and the majority is not. And it should be an examiner and assessor, which is not the case. So it should be one examining you and the other one on the table assessing you. It's not that way. They don't put any mark in front of me. Most of them didn't put any mark. They just keep it to the end and they give you like an overall assessment. And I think every one of them assess his cases. So he is the questioning, he is the assessor. The results will come to you in 1 to 2 weeks. It will be on a Tuesday at noontime. They send you a separate mark for every table and mostly a surprise. That's why I don't want any one of you to care about the results. Do your best, prepare yourself well, go for the exam, do the best in the exam, and ignore the results because the results will be a surprise. You will never find the result which you expected. The stations you feel it, you done very well will be average. The one you did, I messed it up. It will come very good result. This is what happened with me. No single table. I think, to be honest, from 24 stations, I think 3 or 4, which I was expecting the results. Others is, as I told you, it's other way around. If you feel that I've done very badly in this station, the result is very good, and the other way around. And the end, they give you a total score saying you have passed or failed, and I hope all of you will pass. Then they send a feedback to your referee. So if you don't pass, they will send you a referee saying that this candidate is not up to the level, and they blame them. And then if you fail, they book you the next exam straight away. You have a lot of adjuncts to help you with the preparation. So AI is a fantastic tool. YouTube, a lot of channels. I need you to concentrate on the one with basic science, anatomy, and Quantang. You have multiple podcasts. The best of them is Miller also facts and also bullets. Then to take a home message from this, I hope by this station you understand, by this session you understand the game. Try to plan it very carefully. Start early from today. If you're planning to the next exam, keep moving. Clinical, you have to feel yourself in a clinic. And Viva, you have to feel yourself in an MDT. If you do that, if you reach this stage, I promise you, you will pass very easily. Pass is effortless if you are ready. Take your time because your first trial is the easiest trial to pass. And remember, it's not you; it's coming from the gentleman in the sky. And at the end of it, remember that this is the last exam in your life. So relax, do your best at the moment because this is the end of the way. And if you're done with it, you're done with all the exams in your life, which is a really, really relieving point, to be honest. The most, I can say, the most important feeling you will have once you receive the results is a lot of relief. It's not the exam which like master or MDT or MRCS or whatever. Oh, I'm very very happy I passed. No, I'm very very relieved. You'll be relieved because this is the end of the course. Okay, and good luck for all of you and super thank you. So time for the questions. If anyone has any question, just raise it and I'll be happy to answer it. We have 15 minutes for questions. So Ram is asking about AI tools. So AI tools. So Perplexity, this is mainly a search. It mainly do a search for you. Copilot is doing stuff like if you're searching about certain point, answer for a certain question, and ChatGPT is the father of all of them. Good. Any question, guys? You can ask the question live straight away, or you can put in a question answer. It's up to you. So, mm, so how do you prepare? What to start with? So Hatim is asking. So it's if you're done with the basic knowledge, if you have the basic knowledge from part A, you don't need to refine anything. Start straight away by practicing. Book your leaves, book your rota, book your courses, and be prepared to practice. Start from today. Find your buddies which will be helping you in your area or in your hospital, and start. The main start is how to plan your practice. Plan your practice. Get the people who will be practicing with you. Prepare for the course from early. There's all of them. Most of these courses, because again Rami is asking about timing of courses. Most of these courses will be making a timing before the exam. So like Chelsea is in Jan, I think 19th of Jan, if I'm not wrong. Um and The only thing which is the foot and ankle and beads, they've done it once a year, so it will not be there. But I think it's an upper limb definitely will be one. There will be one before February. So just email them or email them. What's her name? I can send you the secretary email, but you found it in Google. Just Google. I think it's an upper limb course, and they run upper limb, they run basic science, and they run lower limb courses, and they do it before every exam. So definitely will be one of them, one before the February exam, so one in January. So just email them; they will send you the timing, and it's definitely one before February exam. This I think Rishi run the Blitz course again before every exam, so it will be around Jan. So it is go for his website, Let's Talk Doctor, and you'll find all the courses. Book the Blitz courses. Um, this is mainly. What's your plan with us? Please help us arrange. So yeah, so I will send you the resources over the next week, and then we will be doing. You choose what you want me to teach you regarding the topics. but we'll be doing a regular practice every week. So you do practice with your buddies, and by every weekend, we'll do a practice until we reach like 2 weeks before the exam or 3 weeks before the exam. Then we'll be doing 2 times or even 3 times practice a week. So the last batch of candidates we done, I think like 10, 12 session. So practice 3 hours. Get all the people to join and practice. I think most of you have already attended with us. So yeah, get them to practice. I'll try to grill you, show you how the exam is. So this is the plan from our side. Balaskovic. So Hatim asking the Balaskovic. So Balaskovic, he has two books: the Viva box, which is the yellow one, and the big box, which is containing clinical and Viva. To be honest, for me, I use Balaskovic for practice only. So I didn't use any knowledge from Balaskovic. So when I have my buddies in the group, so we have group of 3 of us, and we were using like get everyone. If we have a mentor, if we have someone to practice with us, that's fine. If we don't have, we get Balaskovic Viva book, and one of us run it as the mentor, and two are practicing from the Viva cases in Balaskovic. And we do the same with the other book, the clinical book, when we are practicing clinical. So the clinical book, which is this one. Let me show you to be concise. So this is the Viva book, which you'll be using for Viva practice if you don't have a mentor. Some people use it for knowledge. I haven't done that. And this is the clinical book. This one is the clinical book. Good. Any more questions? Any more questions? Use the time, man. Choose anything you want to ask about. So the material I'll be sending over the next week, and yeah, we can start the. I just have the EOA course in. I'm sorry, Congress from 9th to 12th of December. It's the only week I'll be away, but Tamer will be doing some sessions. So as I told you, so from now we have up to February, like I think something around 12 weeks. So first 9 weeks we'll be doing a session every weekend, full session like 3 hours, 4 hours for all of you to practice. And the last 3 weeks we'll be doing 3 sessions a week. So aiming to end by like 12 sessions in total from today of practice, which should be very, very enough. If you're doing a study group, if you're doing some courses and our practice with us for a 12 session, this should be very fine for you. Yeah, I'll send you the schedule, Rami, and I'll send it over the group. So after the resources, and it's definitely will be open for discussion if you like choose certain times. The easiest for all of us is to do it on a Sunday because all of us have clinical commitments. So we normally what we have done before is every Sunday around 8 p.m. from 8 to 11, 3 hours, and we have some attendees and or candidates and have some observers. And then the last 3 weeks, we do it Sunday, Tuesday, Thursday, Saturday, sometimes even. So don't worry. So practice, we will cover a lot. You need now to ensure that your knowledge is enough, basic knowledge is there, and you fill all the gaps of the knowledge. Book the courses from early. Some of these courses are very, very high demand, and sometimes you don't find a space in there. And plan your practice group and start practicing straight away. Ahmed is asking, are there common questions for Viva exam one can focus on? Yeah, so the practice questions we have for Viva covers most of it, but you will never find like a source saying you what Viva. The only two sources which gives you the Viva questions is Oxford book. You can search Oxford Viva FRCS T&O and Balaskovic Viva. But this is not a guarantee. These questions, the one will come. Prepare your knowledge and practice everything in your way. So practice Banaskovich, practice Oxford, practice with us, practice with your group, practice with your consultants, practice, 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 practice. So Viva, at the end of the day, they choose, like, they have a very, very huge bank question over the many years they are running the exam. And you can get any Viva question. But if you ask about common question for Viva as a book, you will find Oxford book for Viva and Banaskovich, Paul Banaskovich Viva book. And from your body, was if you are practicing like Banaskovich, your consultant in the area, the courses you will attend, our course, our practice sessions, you will find that yourself covered a lot of Viva questions. And still, there will be like one or two questions in the exam which is new to you, but it will be new to everyone. So there is no like an ideal source for Viva question, but do your best, practice as much as you can. Practice all questions which you can practice. Any more questions, guys? Good. Okay. So if there's no more questions, we're done with today, and we have tomorrow journal club with the Egyptian Orthopedic Association. Very nice two papers, one about wax trial and one about top cut trial. It's very, very worth to attend, and there will be an attendance certificate which will help you, because all of you after the exam will need to prepare for Caesar, and who are trainees from you needs to be prepared as well for ARCB. So regular journal club is one of the requirements. So I will be offering this regular journal club every month. So it's worth attending. So we'll welcome all of you tomorrow at 7 p.m. London time, which is 9 p.m. Egypt time, Cairo time. And Saturday we'll be having an option about how to prepare your NHS application for this. Those who are planning to change the job or still have someone who is still like going to apply, still coming to the UK. So it will be a very informative one. So this will be on Saturday, 9 p.m. Bridge time, London time. So tomorrow, 7 p.m. London time is EOA Journal Club. And Saturday is Mastering the Bus to NHS application. And this will be 9 p.m. London time. Sessions will be coming, don't worry. A lot of education activities, a lot of sessions. If you find anything you need to know about, just send me. All of you have my contact, and I will keep it here for this. Those who don't know, this is my mobile number, and this is my email. Feel free to contact me if you have specific points you need to know about. And if I like this session came from, I had a lot of questions. So if a specific question, I will answer you. If like a common question, all the people asking, we can run another session to answer all your questions. And a lot of beneficial education activities are coming. So keep on track and good luck. Okay, so if everything is okay, thank you so much for attending and thanks for your time. Hope it was beneficial. You will receive an email with for a feedback. Feel free to say what you want, positive points, negative points, all counts, and all will put in consideration in the next sessions. And you will be granted a certificate of attendance signed by myself, which can help you just at your time if you want to do like an appraisal or add it to your portfolio. Good luck and good night, and see you all. Bye.